Hey, you guys. Thank you for joining us today on the I Believe podcast. I'm your host, Danae Peterson, and I'm joined today with Wendy, who's been a guest on our podcast before. So if you haven't heard from her or listened to the episodes, some of the webinars that she's participated in, the Ion Mental Health like panels that she's participated in, then I'm going to link some of those in our show notes, in our description. You guys can go check those out to hear a little bit more of like some of her insights. But today we're going to be picking her brain a little bit about ctDNA. So if you guys don't know what that is, don't worry, we'll get there. I will also make sure to link some of the like what is ctDNA kind of episodes from Dr. Ma, some other doctors. But we've got a webinar coming up, and I'm really excited to just kind of get a patient's perspective, especially another uveal melanoma patient like myself who's been having ctDNA drawn. It's a blood test. And so, Wendy, thanks so much for joining me.
Yeah, thank you for having me, Danae.
So Wendy, let's chat like just elevator pitch style, like give us an update. Like when were you initially diagnosed? When did you discover that you had gone metastatic? And where are you at today?
Yep. I was originally diagnosed in December of 2018 and, went several years without metastasis and was diagnosed with metastasis in 2023. And it metastasized in a rare way. It metastasized to my breast. And so I was one of the first patients that my medical oncologist started using the ctDNA on. And today, I should add today I have no evidence of disease, which is really exciting. It comes at a cost. I have quite a few side effects from immunotherapy, but those are all pretty well managed now, and I'm actually feeling the best I've felt in several years. So it's really exciting to enjoy my no evidence of disease.
No, that's so exciting. And it's all so just so incredibly hopeful, I think, for the rest of us in the community, especially those of us dealing with metastatic disease, just to like see and hear from someone, even someone who's kind of in a more rare, subgroup of the metastatic community, because I know that sometimes that can feel like, my no evidence of the disease like doesn't really count because like I have like this other piece of the puzzle that was a little easier for them to figure out. Like it hasn't been easy for you.
No.
And your journey is no less valid, in just kind of reaching this point. And but I know that, we've talked about this before in our Living in the Long Middle series. Like it can feel really challenging sometimes to kind of grapple with the I'm okay, but I'm not okay, but I'm also more okay than most people. Like it's a big mind puzzle to figure out.
Yes, it is.
Okay, so let's chat ctDNA. You said you were one of the first uveal patients that your doctor started drawing ctDNA for. So ctDNA blood test, like let's chat about this. Like what is ctDNA to you? And how do you like explain this test to other patients or to like people in your family?
Yep. I explain it. It's a way to catch little floating cancer cells that are in my blood. They took a piece of my tumor from the breast tissue. They took that tumor, they sent it off to, my doctor uses Natera, and sent it off and had it checked, and it came back positive. And so I explain it to my friends and family as it's just a way to know if there's something floating around in my blood, if cancer is active. Maybe before you see it, the results of it in a test. And where it was really impactful is, and this is why my doctor uses it, it's a way to get a picture of maybe how your treatment is working before the scans show it's working. And so about 2 months after I started my immunotherapy, they did another draw and my number came back at 0. However, on the scans, it still looked like the cancer was active. And so it took another 6 months almost before the cancer showed not active on scans. So, I mean, that's a really exciting thing for it. So, yeah.
Well, and I mean, it's such a unique piece of the puzzle that we have the ability to use. And like, just in case you didn't catch it, Wendy said that she had a biopsy of the breast tissue, so a biopsy of an actual live tumor that was confirmed to be uveal melanoma that they then were able to put into this test, basically. So this is a unique individualized test that is, they call it tumor informed. If you listen to the episode that I did with Dr. Ma, where he kind of breaks down the different types of ctDNA. And it basically makes the kind of searching for a needle in the haystack that they use when they're like, oh, it's so hard to find uveal melanoma in the blood. It's like searching for a needle in a haystack. Well, this makes our haystack like a little more narrow, and it makes those needles in the haystack maybe a little sharper for them to like pick up on. Or the magnet is a little more sensitive. Like that's kind of some of the analogies that I've heard kind of noised about in the community, especially from the doctors who use this test, like Dr. Hall, Dr. Ma. I know Dr. Moser out here uses it. And I'm hopeful that we'll see more people using this just because, like, I can't tell you how many times I've heard from patients, and maybe you're one of those patients who your doctor has said, oh, you know, it's been 3 months, you've been on this treatment, it's not working, we don't see it working in scans, like you know, cancer looks like it's growing a little bit, or it's barely stable, or, you know, just, it still looks too active for comfort, we're going to take you off this treatment and try something different. Wouldn't it be amazing if we had, you know, something like this consistently across the board, that we had patients who could use this, right? Because, like, can you imagine, Wendy, if you were taken off your immunotherapy at that point, 3 months after starting it, when they were like, oh, it doesn't really look like it's working.
Yeah.
Like you wouldn't be here in the same way today.
Yeah, exactly. Yeah.
Oh, okay. All right. So when ctDNA entered the picture for you, it was right after you were metastatic, and, you know, obviously right after that biopsy. Why do you feel like you find it helpful personally? Like, what are kind of some of the things that you feel reassured by, especially now that you're like a few years into using this as part of your ongoing cancer screening?
Yeah. You know, it obviously isn't a cure, but it
No.
provides more information. And I'm somebody who requires a lot of information for my brain to stay in a peaceful place. And so the way that we have been using it is I like to get my ctDNA done about 3 weeks before scans. And it just helps me kind of go into the scans with a little more information. So when it's 0, I go into scans just a little more at peace. Like it's just a little kind of going in for a checkup. I mean, it could still come back that there's something active. I mean, it's not perfect, but it provides me a little more peace for scan day. And most recently, I am now going every 6 months between scans, and we do the ctDNA as a middle checkpoint. And as long as it's 0, we stay on the 6 month track. You know, I'm thinking more about the future of how I will use it to maybe get scanned less, because so much anxiety comes with scans. And because we're scanned so frequently, oftentimes things will pop up really early that we have to wait additional time before something can be done about it, or before you can move. We've moved far beyond the days when I was first diagnosed, when you were told you were metastatic and like your time was rapidly ending because it was discovered so late. And so I think ctDNA is just another tool that can help understand, you know, like the aggressiveness with which you need to treat something. So.
Yeah, absolutely. So just out of curiosity, in all of the time that you've had ctDNA drawn since, I think you said it was 2023 when you had metastatic disease initially discovered, has there ever been a time, even, you know, during active treatment, that it has gone up and that you've gone into scans with it elevated? And how have you kind of grappled with that feeling?
Yeah, mine has not gone up. It tested positive at first, and then it has maintained at 0 the entire time. So I'm fortunate. However, you know, when I think about, you know, if I get it again in a few months and it does show up as positive, that's just an indication to me that we need to do scans. We need to see where it is. And I go on a little bit closer surveillance,
Yeah.
and to see.
Well, and
So,
I love what you said about how, like, right now, at least for where you're at in your metastatic journey and just the stability that you have been experiencing, this is giving you an opportunity to not have scans quite as
yep,
often, right? Most metastatic people, even when they are no evidence of disease, like I was no evidence of disease in my metastatic journey. Like I had one liver ablation and then I was no evidence of disease for basically almost 18 months. And
yep,
like, that's a long time to still be having scans every 3 months.
yep,
Like, and we know, like, any of you guys listening, if you've had scans, you know how anxious you feel. Like, we talk about scanxiety a lot in the community because it's a thing. It's a thing that we experience, and it's a full body experience.
yeah,
And and like you said, like there's, and we talked about this in the Seattle meeting a lot with Dr. Hall, with the doctors, I think Dr. Bhatia at Fred Hutch. Like we talked a lot about this in the Seattle meeting at I Believe, because they were just huge believers of the idea that like it's not worth the extra anxiety for our patients for them to necessarily, like, I mean, yes, like we have to balance the, okay, it's helpful to find out sooner, right? To find out
yeah,
if something is growing when it's small so that we can keep an eye on things, literally.
yeah,
Wendy and I both have one eye, if you guys didn't know that. So we find those kinds of phrases really funny. But like it's one thing to find out about it and for you to be able to do something with that information. It's another for your doctor to be like, well, we have to just sit on this. It's not big enough to do anything. We can't biopsy this yet. So I love that this is a unique tool that could be used to kind of space out that cancer screening, especially if you reach a point of stability. But then like on the flip side, when you're in active treatment and you need it to kind of gauge the response, this could be something that helps keep you on treatment when maybe imaging would otherwise kick you off.
yeah,
I would love, I mean, just, hypothetically, like I think this would be a really unique tool to be used across the board for like clinical trials. I think that it would be really, really helpful to have this as a data point. And obviously, like I can't make the rules, but like I think it would be a really helpful data point for doctors to have, because we know so many times cancer responds and it kind of gets inflamed in the imaging and then it starts to shrink. Or even when it's dying, like I mean it's kind of like when a cancer cells die, like they get bloated and die, like poof.
yeah.
um I'm making all kinds of scientific sense here, I know. But I think that your thoughts about this are really just really helpful, I think. And I can see, especially like you're 3 years into using this test almost, and I can see it in the way that you manage your anxiety around your disease, that this has been something that has been helpful for you.
Yep.
um and and I appreciate that like you can kind of hypothetically think about, okay, if it did elevate, that like you have enough experience with the test now to recognize that like, okay, like the goal is not to stay at zero forever. The goal is for this test to be able to detect or whatever it's going to detect, right? And
Yeah.
for us to be able to use that information. I think so many times, like, I don't know, like, do you feel like we sometimes as patients frame it as like, oh, the only good thing is for it to be zero, or the only good
Yeah.
thing is for my scans to be empty? Like, but
Yeah.
they're, I don't know, like, we have to kind of grapple with some of the nuances that come with metastatic disease for sure.
Yeah, and I think definitely, like when you have metastatic disease, like obviously we all want to be zero or have nothing show up forever. Um, but that historically doesn't typically happen for everyone. And so it's nice to just know that you're looking, you have a tool out there that can be used to help find something, earlier. And, I think about it too in the setting of, high risk patients. Can we, and this is me just going off, hopefully it's okay for me to say this.
No, go for it.
These are my thoughts. You have somebody that's class 2 PRAME positive. Can we get to a point where they take the tumor from, especially if you had enucleation, like, and I'm going to say enucleated patients in particular,
Yeah,
you
for
have
sure.
your eye removed, they take that tissue, they create your profile based off of that, and they search early on to see if you have anything circulating in your blood. And then that gets you, like opens up more doors for more clinical trials or something like that. Like that's what excites me about this even more than how I use it. That's because I do think that that's a real possibility in the future.
Yeah. I mean,
And
that's
so
literally
yeah,
what I was talking to I was talking to some of the people that I know who use ctDNA and like kind of some of the research people behind tests like this. And I was telling them, I'm like, this would be so cool to use like alongside the Castle biopsy test, right?
yes,
Like, I mean, of course, we have the enucleated eye tissue is probably going to be a little bit easier to use to test
yeah,
with because you've got slides and slides and slides of,
yeah,
eye to work with.
yeah,
Um, but like there's so many things in the ocular oncology community. Like Dr. Jesse Berry is talking a lot about aqueous biopsies and how we can use the fluid in the
yep,
eye to like kind of detect what's going on. And if there's cancer cells floating around in the fluid of the eye. And like then we have the Castle test, which takes, the needlepoint biopsy. Okay, well, can we take core samples like at the time that they treat even a plaque, like a plaque
yeah,
treated eye or a proton beam therapy treated eye? Like, can we take those samples and save some in storage, or like make sure that it just gets sent off to a tumor informed testing center, something like Natera, that they can use that tissue to do exactly what you said, to track metastatic possibility, especially for those higher risk patients.
yeah,
I would love to see this used more actively earlier on, and I kind of
yeah,
wonder if that's maybe the direction that that it will start to pick up momentum more. Because
yeah.
I don't know, Wendy, like, have you talked to other patients who are metastatic and they're like, what is ctDNA? Like, I've never heard of that.
Yes, and whenever I hear that, I'm one of the first things I tell newly diagnosed metastatic patients is ask your doctor about ctDNA. My doctor uses Natera. There are other ones out there, but you know, ask about it. I think it's
Yeah.
a really important tool. And I think it's still new enough that not all providers like really truly understand what it is, especially in the ocular melanoma space.
Hmm.
It has been widely used in other cancers for quite a while, but it's newer to the ocular melanoma space.
Yeah, absolutely. Okay, so rapid fire, a couple questions, things that
Yep.
maybe somebody who's new to having this test or wanting this test done should know about, as a patient. So, in your experience, and I'm going to also share my experience because I've also had ctDNA draws from Natera, using, obviously my oncologist orders the tests. But number one, do you have any level of financial responsibility for the test? Like, is it covered by insurance? Do you have to pay out of pocket? Like, how does it work for you? What's been your
Yep.
experience?
So I have not paid anything out of pocket. My insurance does not cover it. They have denied it every time. I have been told by my doctor to not worry about that. I think there's some sort of agreement. I'm actually not positive on that. I
Yeah,
just know that just like the Castle test, I have not paid anything.
yeah.
And my insurance denied the Castle test as well.
Okay, so
And
that's
yeah,
important for sure.
yep,
And that's been
yep,
my experience as well, is that my insurance claim shows this is a denied test, that, it's too experimental. However, my doctor has told me, okay, like, but you're not getting bills. Like, Natera's not sending you bills because, like, essentially he's like, they're treating this, this specific company, maybe not all of them do this, but this specific company treats uveal melanoma patients, testing as something of like maybe a write-off. Like I think that's what Castle does too, where they are able to financially kind of sponsor just to like bulk up the ability to gain the research so that they can then submit that to insurance and say this test does work, we need to be able to use this with patients. That's how we get to that point, right? Like Castle now, in some insurances, Castle gets a payment from insurance because they have the data to prove over time, and
yeah,
all of the patients and the data that they've collected. Like they have the ability to prove that there's merit in doing the test and that it helps influence, treatment decisions, monitoring decisions, all of that. And so like that kind of information doesn't come without patients to, gather the data with. And I like companies like this understand that. So,
yeah,
I mean, that's been something that I have also experienced is that I haven't been held responsible, even if my insurance has come back and denied the claim.
yeah,
So that's something maybe to tell your doctor if they're like, well, I don't want you to have to foot the bill for something like this.
yeah. Have them get
Okay.
in touch with Natera. just to see.
Yeah, like and like what's it going to hurt to ask, right? Like,
Yeah.
they can ask about Natera. Like Natera has incredible patient advocacy groups and
Yep.
just patient coordinators who like will talk to you as a patient and they'll help you figure out like how do I bring this to my doctor? So, I mean, there's companies that have the tools and the resources in place for the patients to be able to kind of piece together how could this become a part of my care.
Yep.
Okay, so other question. How do you get information? Like, I know we're kind of living in the age of my chart. Yay for us.
Yeah.
But do you personally utilize like Natera's patient portal? Do you just wait for information from your doctor? Like, what do you find to be kind of helpful to you at this time?
So Natera, I haven't actually been in the Natera's patient portal because I do get the results through my chart from my provider's office before Natera reports it in their portal. So I usually have the results. It gets uploaded in my chart. I usually have the results probably a good 5 days before Natera says your test results are ready.
Oh my gosh, that's crazy.
And as I'm thinking about it right now, actually, I have used the patient portal. I've gone in and looked at like older tests because I wanted to go in and I can't remember what I wanted to look at something. And so I've gone into their patient portal and I have looked at it. But for me, it gets reported later than when my doctor like provides it to me. So
That's so interesting. Like, I feel like my experience has been kind of the opposite. Sometimes I find out from the Natera portal like faster than my doctor finds out. And um and sometimes I'm the one messaging them and I'm like, "Hey, so my Natera like Signatera's in. What are we going to do about that?" Or like, "What do we
yeah,
need to know about this?"
yeah.
So it's so funny. Like, but man,
The other thing
um
I love about my doctor's office is, I've been a patient with them for what, 6, 7 years at this point, and they know me and they know like how quickly I will message if something is concerning. And so I usually get an email from them within minutes of it posting to my chart saying, great news. You're still at 0. Everything, we'll keep going with the status quo of what we've been doing. So it's just a funny thing that how they've gotten to know me and know that I will probably reach out, although I wouldn't reach out when it's 0.
yeah, for sure. For sure. Oh my goodness. All right. So, what would be like your advice to somebody who's a newer patient or even somebody who's a pretty well established like metastatic patient, um, if they're considering having this test done? Like,
I think the advice that I do give people is you have to look at it as information. You can't look at it, you can't go into it thinking this is going to answer all of the challenges that come along with metastatic disease. It's just another information point to help us decide what's best for us, as we get treatment. I think about, for me, unless there's some really dire situation, I will not have more immunotherapy. My body it liked it. And it
it
over,
liked it.
it very much activated it.
Mhm.
And the risk of doing more immunotherapy is greater than greater than not doing it anymore at this point. So, and for me, I don't have disease in my liver. So really systemic is the only option for me if it comes back and still isn't in the liver. And so just provides a data point of if that number comes back elevated, just starts me thinking about, how do we want to approach this to tackle it, knowing that I probably can't have more immunotherapy, at least not the immunotherapy I had. It just helps me start the wheels turning of, okay, I've got to get back on potentially thinking about what's next, where right now I'm really not thinking about that. I'm just thinking about, I'm so excited that I'm living, my issues from immunotherapy are under control, and I'm just enjoying for the first time that I'm no evidence of disease, like just enjoying this life that I've been given. And um, and this test continues to provide that peace for me. So
Absolutely. Well, Wendy, thank you so much for being a guest today and for chatting with us about this and just making sure that those of you guys listening have an opportunity to hear from just a patient, not just a doctor, because I do think it's important that, yes, doctors use this test and they, some of them really love it. They have good reasons for using it, but I feel like there's just a layer of reassurance and validation that comes from like hearing from somebody who is a patient like you. So thank you for being that for us today, Wendy.
Thank you for having me.
And I'm so glad that you get just somewhat of a break between your scans. I think we all can relate to just wishing we could just have a break. And I think it's nice to know that this is a way that has kind of afforded you the opportunity to have that break and just to have something in between too, so that you're not just waiting 6 months. So I love that for you, and I'm so grateful to have met you, and I look forward to seeing you again later this fall. It'll be so fun. See you in Dallas.
Yep, see you in Dallas.
Yeah, and if you guys aren't aware, you can come see us in Dallas too, because we have the I Believe conference with Dr. Harbour and his team there. And we're super excited to be in the Dallas world. So come see us, watch our website. You can just get your free tickets and just keep an eye out for the hotel block, because we are going to be dropping that, I would assume very soon. But we know that everybody's got to be able to book a hotel room and come and stay and check for flights, all those pieces. So just keep an eye out for those things. And we are super excited to see you guys in Dallas again. In terms of how we can do this podcast, I just want to say a huge thanks to our sponsors. We've got Delcath Systems, IDEA Biosciences, Castle Biosciences, and Aura Biosciences, each of which they contribute a sponsorship number that goes toward covering the cost of producing the podcast. So we couldn't do this without our sponsors. Thank you guys for just participating and making sure that we can continue to empower and inform patients, and just make sure that they have the education that they need, and that they, that we're keeping you guys up to date on some of the kind of cool new things that we have out there in the uveal melanoma space. With that, I will let you go, Wendy, and we will talk to you guys next time.
Okay. Thank you, Danae.